Hello and welcome to Chapter 12 in Electronic Health Records. We're going to be talking about personal health record and patient portals. So if you want to follow along in the book, we're starting on page 312, 313 with the introduction to the chapter. So what it says here for Beyond the Record, approximately 80% of internet users say that they have conducted an online search to determine what medical condition they or someone they know might have. And a 2015 study showed that there are more than 165,000 health and medical apps. 2/3 are focused on general wellness topics such as fitness, lifestyle, stress, and diet. The remainder consist of apps focused on specific health conditions, with mental health and diabetes the most popular conditions. Other popular apps include medication information reminders and women's health and pregnancy. And if you look at the personal health record timeline, you see that in 1950, patients were encouraged to keep written personal health logs to track their health information. And in 1978, the actual term personal health record was first used in an article. So this is not a new concept. People have been keeping copies of their information for a long time now. All right, so moving over into the introduction. So, consumers today are faced with many decisions regarding their healthcare. For that reason, they have become better educated about healthcare cost, treatment options, and preventative care. In addition to becoming more informed, many individuals have taken control of their healthcare by creating a personal health record or participating in a patient portal. Personal health records and patient portals have two goals. First, to have health information available at the point of care. And two, to help foster enhanced communication between the patient and the healthcare provider. And so this chapter is going to talk about these tools and how they have evolved in patient care. So what is a personal health record? Well, it's a tool that enables an individual to plan and manage their health information with practitioners to make more informed decisions, which may contribute to a better quality of care. To use this tool, patients gather their demographic information and health data and enter the information into a formatted document or an online template. The result is a record that contains a complete overview of the individual's health history and current health status. Aside from forming a complete summary of the individual's health, a PHR may also be used to do the following: track and update health information from any location via a computer, tablet, or a smartphone, coordinate care among selected healthcare providers and facilities, locate information about diseases and conditions, avoid duplication of tests and procedures, monitor prescriptions, allergies, wellness, and research, and share health information with selected providers and healthcare facilities. And moving over to 315, looking back at that timeline, PHRs emerged at the turn of the century. Since 2000, there's been a steady rise in both interest and use of PHRs by individuals who want to take control of their healthcare needs. Because of the relatively recent popularity of PHRs and changes in healthcare, national organizations have struggled to come up with a common definition of a PHR. And so in Table 12.1, you see that the National Committee on Vital and Health Statistics, AHIMA, the U.S. Department of Health and Human Services, and HIMSS all have their own definitions for PHRs. Now, one thing about this is, one thing that is consistent in definitions for PHR is that they should be accessible, secure, private, and comprehensive. To that end, in 2002, the Markle Foundation, an organization that promotes the use of technology to improve people's lives, created Markle Connecting for Health. It's a public-private collaboration focused on improving health through the use of information technology. Representatives from more than 100 collaborating organizations were tasked to develop policies that would be shared among patients and healthcare providers. And the outcomes of the work group were as follows. So they wanted to accelerate the development of the PHR, increase the patient's relationship with the healthcare provider and involvement in his or her care and safety, develop a common data set, and develop a variety of approaches to creating a PHR. Now, to fulfill these goals, the Markle Connecting for Health developed 7 best practices for PHRs. So, 1, each individual would have his or her own PHR. 2, PHRs are to provide a complete medical history for an individual from birth to death, so it's a longitudinal record. 3, PHRs are to contain information from a healthcare provider. 4, PHRs are to be accessible from any place at any time. PHRs are to be private and secure. PHRs are to be transparent. An individual can see who entered the data, when the data was entered, and where the data was imported or transferred from, as well as who is actually viewing the data in the PHR. So remember, that's kind of given us that metadata, data about our data. And then the last one, PHRs will permit the seamless exchange of information across healthcare systems. So what makes up the content of a PHR? Well, recommended information for the PHR is going to include demographic information, so name, address, telephone, email, date of birth. And just like if you went to the hospital, they're going to want emergency contact information, how to get in touch with someone, name, address, telephone, email. Again, insurance information, religious preferences, advanced directives, who your providers are, any health issues that you have, if you have a dentist or any dental issues, what pharmacy do you use, who's your optometrist, what are your allergies, your blood type, current meds, and so on. You see that table continued over on 12.2 on page 317. So the PHR should be organized so it's easily accessible to the necessary parties and covers all pertinent health information. Depending on the type of PHR selected, whether it's paper or electronic, because you can have one or the other, the information would either need to be keyed or scanned to the PHR. Many health information organizations have created templates for users to use. So AHIMA, they created the MyPHR website to inform consumers about PHRs, suggest information for them to gather, and provide them with links to PHR templates. Now, ownership of a PHR. The patient, I'm going to say this again, the patient has complete ownership of a PHR, including the setup and the maintenance of the record. So, unlike the health record in a hospital or in a physician's office that belongs to the clinic or to the hospital, the PHR belongs to the patient. They have complete ownership of this. So the patient establishes the parameters for the parties who can view the record and for the data that they can access. A patient can limit the type of medical information provided to family, healthcare providers, or healthcare facilities. So, for example, a patient may choose to have only information about medications and allergies available to family members, but they may grant a healthcare provider or facility access to their entire health record. All right, so let's talk about the general types of PHRs. So, of course, we have our traditional paper PHR. We're going to talk about computer-based PHRs, and then we have web-based PHRs. So, let's talk about paper first. So, paper, of course, is a collection of the medical documents and personal journals of an individual's health history, and this is what actually became prominent back in the 1950s, since families were encouraged to keep documents of their medical treatments, procedures, vaccinations, and so on. The goal included monitoring and improving their overall health status. Now, some of the advantages of having a paper PHR is it's low cost. It's not costing a lot of money to keep paper. Individuals who continue to use paper health record also like the privacy and security, because as long as I have that paper in my hand, no one else has it. It's not off in cyberspace where someone can hack into it and get my information. This is also easily portable. That means I can easily take my paper health record and take it to my doctor's appointment with me. So the ease of use of paper. Now, there are disadvantages. There's a lot of disadvantages to paper. First of all, it's sometimes hard to assemble and organize and update. Now, if I don't have an established format, then it can also lack the details to provide that complete picture of my health status. Now, lastly, in an emergency, a paper record is either unavailable for use or difficult to decipher by an attending healthcare provider or an emergency facility. Privacy and security of paper PHRs are also drawbacks to this type of record. So, unless placed in a secure location, a paper PHR is accessible to others who may invade the privacy of the record's owner. So, whereas sometimes you think it may be more safe and more secure, you again don't have any clue who looked at that paper record. All right, so let's move on to our computer-based. Now, computer-based or software-based PHRs are similar to paper, but they have an electronic format. Patients can purchase or download PHR software and install it on their chosen electronic device. You can use an app on your phone or your iPad. You can purchase things that would be on your personal computer. So this is known as a standalone or an untethered PHR. And it's not designed with the intent to share information electronically with other PHRs or other EHR systems. So think about this as a standalone. It belongs on my phone. I'm not electronically sending any information to any other system. It's a standalone system. Now, the patient or his or her designee is responsible for entering the data into the program, as well as attaching any documents or images to accompany the data. Therefore, the patient is in control of an untethered PHR. So when a patient visits a healthcare provider or facility, he or she can print the health information or transfer it to a portable storage device, such as a flash drive, memory card, or CD, so that the data can be transferred to the health record. Now, some advantages of a computer-based. So portability, again, we talked about how we can put it on a flash drive and take it with us. It can be password protected, and it's not connected to the internet, so it's more secure than your paper PHR. And it also allows me to back up my health information so that I'm not, likely to lose it. But some of the disadvantages is it's only accurate as the accuracy of the typist. So if I type something wrong, then my information may not be accurate. Patients must exercise caution when inputting information into the health record. Another disadvantage is the lack of internet connectivity. Again, I can't share this information electronically with another PHR system or with an EHR for my physician's office. Now, while this aids in security, it just makes it that much harder for me to maintain the accuracy of my records. Lastly, not all healthcare providers have a computer system compatibility that allows them to accept an external media transfer of information into the EHR. And so if the system is not compatible, then the healthcare provider or facility cannot read or upload the information. So sometimes they could take that flash drive, put it into their computer at the clinic or in the hospital, and would be able to at least save the information or print the information so that it could be scanned into their EHR. But if that system's not compatible with what they have, who's ever tried to open a document before and you didn't have the right program to read that? So let's say maybe I was using WordPerfect, which is like a Microsoft Word product, but I can't open it in Microsoft Word. It's not going to allow me to do that. So think of it in that way. Okay, so now we got our third. We have our web-based. Now, to use web-based PHRs, patients have to have access to a computer or digital device and have an internet connection. Web-based PHRs are either tethered or untethered. Now, a web-based tethered PHR is health information that is attached to a specific organization's health information system. An untethered web-based PHR is not attached to a specific organization's health information system. So let's talk about tethered. Now, web-based PHRs may be provided through the patient's health insurance, their employer, through the healthcare facility, or a healthcare provider, and it's stored on a server owned by a third-party organization. To gain access to the health data on a tethered PHR, patient is going to use a portal. Now, once access is granted, a patient may only make limited changes to the record, such as a change in insurance coverage. Because the PHR is attached to a covered entity, the patient's health information is protected by HIPAA. However, patients should be aware that this type of PHR does not meet the best practices criteria of the Markle Foundation. Tethered PHRs may be provided again by health insurers, healthcare facilities, and employers. Now, let's talk about the ones that are offered through your insurance. So, a lot of health insurance offers subscribers the opportunity to participate in their healthcare with a tethered PHR known as a health insurer provided PHR. So, they often populate information about a subscriber, such as insurance claim information, a list of providers, prescriptions, and benefit coverage. However, a subscriber can also enter his or her own data. They may also access additional resources such as wellness information on exercise, nutrition, weight loss, pregnancy, smoking cessation, and any other topics that may encourage them to become more healthy. Now, because health insurer provided PHRs are owned by companies rather than patients, these records are not considered to be true PHRs. One advantage of a health insurer provided PHR is that the health insurer updates the PHR as information becomes available. That way, the patient's not solely responsible for entering the health information updates. Information may be extracted, printed, saved, and sent to various healthcare providers and facilities. Okay, next let's talk about our facility provided PHRs. So these again come from physicians or healthcare facilities, and this type of PHR, known as a facility provided PHR, links the EHR and the PHR and allows the patient to access the PHR portions online using a username and an access code. This type of technology is relatively new and is increasing in popularity. Many of these types of PHRs are static, meaning that the patient may only view the information. There are several features that a tethered PHR from a physician or healthcare facility may include, such as a messaging feature that provides the patient with the opportunity to email a provider, request an appointment, review test results, request a prescription refill, and view reminders. And the section titled Patient Portal on page 332 walks you through the feature of a facility provided PHR. So you can go check that out. All right, now let's talk about employer provided PHRs. So in 2006, several companies, including Intel, BP America, Pitney Bowes, and Walmart, formed an organization called DOJA. In 2008, DOJA offered PHRs to employees of the companies that formed DOJA. This type of PHR, known as an employer-provided PHR, contains data from hospitals, doctors' offices, health plans, laboratories, and pharmacies, as well as information entered by the employee. The goal of the employer-provided PHR is to enable employees to make better health decisions. Achieving this goal is a win-win situation for both employees and employers. Employees improve their health and well-being, and employers reap the benefit of decreased insurance costs and employee absenteeism. Now, there's several advantages to using an employer-provided PHR. One of the biggest advantages is that it's not limited to one healthcare provider or facility. Employees may enter health information from all of their providers and can determine what information can be shared. Another advantage is that the PHR is web-based, so you can access the content anytime and anywhere. So, for example, patients can access their PHRs from providers' offices or healthcare facilities by entering a username and a password. And lastly, an employer-provided PHR is available to the employee for life, even if you're no longer employed by that organization. Now, there are a few disadvantages here. One of the disadvantages is that employees are responsible for entering the information and keeping it current. Another potential disadvantage for an employer-provided PHR is that many employees are not comfortable sharing sensitive health information with their employers or have misgivings regarding how their data will be used. All right, back to untethered PHRs. And I think if we go back to slide 8, we have some information here about our untethered. Now, these allow the patient to control the information in the record by customizing access rights for family and providers. The patient can create a username and a password to ensure the security of his or her health information. And because the PHR is web-based, the patient can access the record at any time. And web-based untethered PHRs are available for free, or you may have to pay a small fee for those, or a big fee in some cases. All right, back to page 323. So a web-based networked PHR is the type Markle Connecting for Health imagined. It can transfer information to and from various healthcare providers and facilities, so doctors, pharmacies, labs, insurance companies, and so forth. Now, this interoperability saves the patient time and ensures that the information in the patient's PHR is accurate and current. For example, when a patient visits a dermatologist, the office staff updates the patient's diagnosis and procedures. Then, when the patient goes to the pharmacy to retrieve the prescriptions the dermatologist just prescribed, the pharmacy staff updates the insurance claim information to the network PHR. Now, some advantages is this type of PHR is accessible anytime from anywhere as long as the patient has an internet connection. Information is shared among multiple providers and facilities. Individuals can select the information that is shared with family, healthcare providers, and facilities. And the PHR is kept more accurate, up-to-date, and complete because of the input of the healthcare staff. Now, although the network PHR offers several advantages, one disadvantage is the issue of privacy and security. All right, so let's go over to page 324 and let's evaluate PHRs here. So some clear benefits have emerged as PHRs are being increasingly used by consumers. Many national healthcare organizations have been outspoken advocates of PHRs. They've not only encouraged consumers to use these health records, but also created website templates for their use. There are several issues with the patient, there are several issues that a patient should consider when determining the type of PHR to select. So first, is remote access available? Can I get to it anywhere? Do I have to go to a specific location? So can I do it remotely? Can I do it from my home? Can I do it from my work office? Can I do it in the doctor's office? Is online storage available? Third, if the PHR is web-based, how trustworthy is the site? 4, how is information kept private? And 5, is the information secure? Now, the primary benefits of a PHR is that a patient and his or her healthcare provider can view a complete chronological health history for the patient. Patients can access information about their healthcare providers, treatments, vaccinations, medications, allergies, and other types of health data. Knowing this information allows patients to make an informed decision about their own health and wellness. PHRs, I'm dropping to that bottom paragraph there in that section, are offered by covered entities such as healthcare providers and health plans, have the added advantage of being covered under HIPAA. The HIPAA privacy rule protects the privacy of information contained in PHRs. All right, jumping down to our advocates of PHRs. So, many healthcare organizations have voiced their support for the benefits of PHRs. In 2003, the VA, Veterans Administration, rolled out the My Healthy Vet website, which is a web-based PHR that veterans can use to maintain and update their health information. A PHR like My Healthy Vet improves the continuity of care for veterans who move often and or visit a variety of healthcare specialists. Another outspoken advocate for the use of PHRs is CMS. In 2006, CMS began several pilot programs to encourage Medicare recipients to use PHRs. Now, we talked a little bit about benefits of PHRs and PHR systems, and so you can see in Table 12.3 on page 326 several of those. Be familiar with those. Be familiar with the roles, whether it's consumers, patients, and caregivers, and then what their benefit is of a PHR system. All right, so over on page 327, let's talk about the overall challenges of PHRs. So similar to the lack of EHR interoperability, PHRs are faced with the same communication challenges. Some network PHRs can communicate with healthcare provider systems, but most of the PHRs are not interoperable. Privacy and security concerns also affect the adoption of PHRs. Those PHRs not offered by HIPAA-covered entities fall under the privacy policies of the PHR vendor, as well as any other applicable laws that govern how information in the PHR is protected. In addition, there's currently no federal law that covers the storage or transmission of PHR content. These privacy and security issues are troubling and must be addressed. Lastly, depending on the type of PHR, the information in the record may not be accurate, up-to-date, or both. For PHRs to be effective, patients must assume the responsibility of maintaining the record, and that's a task that can be time-consuming. Now, let's talk about the PHR or EHR-PHR connection. So, depending on the type of PHR, his or her information may be shared and or integrated. Although an EHR and a PHR have different characteristics, these records share a common goal: to provide a complete picture of a patient's past and current health status. To meet this goal, the two entities must be connected, allowing the exchange of information. Now, you can see in this next slide and on the table 12.4 on 328 the EHR and PHR connection that gives us our purpose, the ownership, updates, legal information, access information, and use. And so you can compare those there. Now, a networked PHR is the only type of PHR that has the ability to exchange information between the PHR and the EHR system. To that end, Health Level 7 International began to address the standard for the EHR in 2007 by developing a model known as the PHR System Functional Model. This identifies the features and functions of a network PHR. These features and functions are also linked to the functions in an EHR, creating pathway for providers, facilities, and patients to exchange information. And you can see that in figure 12.5 on the top of 329. All right, we're going to move on over to page 330, and we're going to talk about creating a PHR. So there's several steps that an individual must consider before creating their PHR. Individuals should consider what their needs are, how they're going to organize it, and what their preferred storage mediums are. Now, first, a consumer should request a copy of his or her health records. Requesting health records entails completing a HIPAA-compliant form for a release of records from healthcare providers and facilities. And again, if you've ever went to the hospital and got a copy of your medical records, there is a fee for processing the copies of these records. These days, some facilities will actually give you your information on a jump drive as well, instead of printing the physical paper. You can get it on a CD or a DVD or a jump drive. Now, while waiting for the health information, consumers should review various types of PHRs and select the one that meets their needs. They should then organize their health information in folders or in a binder until all the information has been acquired, so that the transfer of information from paper to an electronic format will be easier. The information received in an electronic format may be copied or transferred into the PHR. Now, storing records. So there's several ways to store health information for a PHR, such as a flash drive, CD, secure digital card, portable hard drive, online cloud storage, computer hard drive, or even a 3-ring binder. The selection of a storage device depends on the needs of the owner of the PHR. Several factors to consider include issues of portability, security, maintenance, and accessibility. Other considerations include whether the owner of the PHR wants to do the following. If they want to physically transfer the data or use a web-based PHR, if they want to store the information online or use a physical storage device, or if they want to export the health data in a portable document format, a PDF, that would be readable in many different programs. All right, moving over to the patient portal. Now, The concepts of patient portals were created out of the growing popularity of PHRs as well as the adoption of EHR technology because it interfaces with the healthcare facility's EHR system. A patient portal provides a patient access to his or her medical records, appointments, messages, billing, connection to family records, and administrative information. During a patient visit, healthcare providers offering patient portal access will invite patients to register for access, ultimately providing them usernames and access codes. Patients can then create an account and gain access to the portal. Now, I'm not going to read through each one of these sections, starting with menu of a typical patient portal, but you want to be sure that you are familiar with those. Those options include messages, appointments, medical records, family records, billing and insurance, administration, and preferences. And so if you follow along from 332 all the way over to 342, it's going to take you through each one of those sections. So we're going to pick back up with the chapter summary. So again, be sure to read through those sections and be familiar with those. So in our summary, we talk about a personal health record allows a patient to gather, track, update, and share their health information. PHRs may be one of three types: paper, computer-based, or web-based. They can be classified as tethered and untethered. Tethered PHRs are linked to a healthcare provider, facility, or a third-party payer. Untethered PHRs are those in which the creator of the PHR enters the health information and the record is not associated with a healthcare provider, facility, or a third-party payer. Aside from maintaining a complete health history of a patient, a PHR also provides improved communication between the patient and his or her caregivers, increased patient safety, and significant cost savings for patients and providers. Many healthcare providers have created their own patient portals as part of the EHR technology with helpful features for messaging, scheduling, medical history, billing and insurance, and administrative purposes. So again, be familiar with your acronyms and initialisms at the end of this section or at the end of the chapter. And again, read through those pages that we did not cover in lecture. Good luck and happy reading and happy studying.